Hello and welcome. You're watching the News Unlocked, the show that takes you behind the headlines to the real stories that matter. And today we focus on the rising number of coronavirus cases globally, but also in India, but also look at another aspect of it, the rising number of cases where people are recovering, as well as a new threat, that of coronavirus reinfections. That's right. The first confirmed case of Covid-19 reinfection was reported by researchers at the University of Hong Kong in the last week of August. Since then, other cases of reinfection are emerging, including here in India, especially a few cases that have now come up in Hyderabad. Therefore, at a time when coronavirus remains a threat, we're going to focus on two key aspects, reinfection and recovery. Let's start though first with this report on the reinfection crisis that could still be shadowing corona. Take a look.
With over 55,62,000 cases, India is witnessing a spurt in COVID-19 cases every single day. And of late, certain cases of reinfection from the virus have also started to emerge.
मला परत कोरोना झाल्याचा रिपोर्ट पॉझिटिव्ह आलेला आहे.
In Maharashtra's Nanded, BJP MP Pratap Patil Chikhalikar has tested positive for the second time, almost a month after his first bout of infection.
दो प्रकार के एंटीबॉडीज रहते हैं, एक IgM एंटीबॉडीज और एक IgG एंटीबॉडीज. ये जो IgG एंटीबॉडीज है, वो IgG एंटीबॉडीज अपने को प्रोटेक्शन देते हैं कि दूसरे बार इन्फेक्शन न हो जाए. बराबर है. यदि पर्याप्त स्वरूप से किसी के शरीर में ये एंटीबॉडीज IgG एंटीबॉडीज तैयार नहीं हो सकते हैं, तो इसका मतलब उसकी रोग प्रतिकार शक्ति कम हो जाती है और उसको दूसरे बार इन्फेक्शन होने का चांस रहता है.
Two healthcare workers from Government Institute of Medical Sciences, Greater Noida, also tested corona positive for the second time.
That there are mutations which are taking place. And secondly, which was one important finding, was that there was a mutations against the neutralizing antibody which were produced in the body. So one thing that could be that either the antibody that were initially produced were not lasting for a longer time, or secondly, the antibody which were produced against the first genome was not effective against the second genome. So these are the two possibilities which we are working on.
But India's apex health research body, ICMR, believes that the cases of reinfection are very rare and not a matter of serious concern.
We can have reinfection with the COVID, and it is not a matter of serious concern. And these, whenever one point has been noted, that whenever reinfection occurs, both the infections have been mild and therefore the reinfection occurs.
While health experts generally believe people who had COVID-19 will have some immunity against a repeat infection, they don't know how much protection or how long it would last, fueling fears about the effectiveness of potential vaccines against the virus.
We are not very sure whether if the vaccine is developed, whether we have to take it 3 monthly, 6 monthly or a yearly. That will be a big challenge for vaccine development.
Cases of reinfection in India come close on the heels of the first case of reinfection confirmed in Hong Kong. In the last week of August 2020, a Hong Kong researcher's announcement shook the world when he announced that once infected by COVID, the patient might get infected again. The researcher found that repeated infections of COVID-19 may be a norm in the future.
The patient is a 33-year-old man who was initially diagnosed with COVID-19 in March, and it's a local case in Hong Kong. And then the patient subsequently in August, which is 4.5 months later on, when he returned to Hong Kong from Spain via London, he was diagnosed again to have a second infection of COVID-19.
Within days, 2 European patients confirmed that they have been reinfected with the novel coronavirus. One in Belgium and the other in Netherlands, shattering the earlier held belief that once someone recovered from COVID, that person did not have to worry about the virus anymore.
So is reinfection for a COVID patient a real threat, or are these stray cases? We're going to talk about that first and then go to recoveries. Let's talk about reinfections. I'm joined by two of the country's top doctors in this respect. Dr. Hemant Thakkar is consultant physician and in several of Mumbai's top hospitals, Breach Candy, Jaslok, Bhatia, Reliance Hospitals. Dr. Rajesh Chawla is senior consultant respiratory and critical care at Indraprastha Apollo Hospital in the national capital. Appreciate both of you joining us. Dr. Thakkar, why don't you take that? Have you come across any cases where patients who have recovered develop any symptoms that could suggest a possible reinfection? Is that a real threat? We've seen a few cases in Hyderabad, for example.
See, for you to say reinfection dogmatically and certainly, you have to identify the virus and you have to get a genome sequencing done. You just cannot say, you see, it's so common in this monsoon era where the seasons are changing. You're going to get a cough and cold anytime. So somebody who had COVID in May or June, suddenly when the season changes, gets a cough, cold, and a runny nose and runs fever. Everybody clamors and says it's a reinfection. The question is testing it. And if you test it, you send it to only specific laboratories where you can do a genome sequencing. Theoretically, if you ask me, yes, it is possible. Practically, if you ask me, remember, this is like the flu. Every year you take the flu virus shot, because the flu virus antigens keep changing. But the fact remains that if you had something of the corona family infecting you in May or June, I fully agree with what ICMR says. Even if a neighbor of the family which has mutated into that infects you, you're going to have a milder disease. So I don't think we should put the cart before the horse. Let the Virology Institute come up with it. In practice, I have not tested anybody with this mild cough, cold, fever and seen a reinfection that people are describing. There are very few in numbers and we need more evidence.
So you're saying you need more evidence before you can suggest that someone could get a reinfection after having acquired an element of immunity if in May, June, he or she had corona. Let me take that to you also, Dr. Chawla, because, you know, is there those who have weaker immune systems, compromised immune systems, are they at greater risk, or do you believe that also would be an exaggeration to suggest that those with weaker immune systems could be more prone to a possible reinfection of some kind? I don't think I'm not getting the audio of Dr. Chawla. I'll come back to you, Dr. Chawla. Go ahead, Dr. Thakkar. Do you believe that those with weaker immune systems could be more prone?
Definitely people with weaker immune systems would push out and make weaker antibodies. So as was told to you earlier, IgG is the protective antibody. If you have an infection, you produce the protective antibody called IgG. If we give you a vaccine, you produce the protective antibody IgG. So people with poor immune systems have a poor antibody producing mechanism. So they probably produce inappropriate or weaker or smaller varieties of antibodies and thus make them susceptible to frequent infections.
So now, they need to be more careful. So they need to be presumably more careful even after recovering from corona. They need to be much more careful about their lifestyle. Dr. Chawla, sorry, you want to respond, Dr. Chawla? Are those with weaker immune systems in a way more prone possibly, if not for corona, but for other possible ailments post-corona recovery?
You know, first of all, you know, we are in the 9th month of infection and hardly you can count on fingers the number of proven reinfection by genome reported. You know, I also personally had seen a patient, a policeman who just got tested in Delhi because there was a camp going on. He got tested, he came positive, and then he got admitted and he recovered. Then after about 30 days, he got now the symptoms, and this time we tested and we did a genome studies. We did not have the genome studies of the previous test, but we could not say that it was really a reinfection or the persistence of infection. One thing which I want to stress is that person can be positive even up to 140 days, because they may not grow on viral culture, they may be dead virus, they may be just a viral particles. So just being positive up to even 140 days does not mean that person has got a reinfection. And if a person has a symptom twice and he has a genetic sequence genome which proven that there is a different genome sequence, only then you say that it is reinfection, and the cases are very minimal. This is not a threat. Even our patient first time was asymptomatic, then the second time he had a mild symptoms. As you just heard, these patients, even they are getting reinfections, they are very mild patients. Even if they don't have antibodies, they have a T-cell immunity, and so far this is not a bigger threat.
Okay,
now the second question you asked
both
about
of you believe that
with
such cases are very, if at all, and you need far more evidence to suggest it's reinfection. At best, you may get a cough and cold a few months later. You've got to be careful, but you would not call it a reinfection. We've got the reinfection bit. I want to turn to the next bit, because we've just seen in the last few days recovery rates in India are rising. They've crossed 80% now, and that perhaps has led to hopes that maybe the number of active cases, while they may be rising, the fact also is the recovery rate is also growing. According to the Health Ministry, it's the highest in the world now. Take a look.
India has now seen over 44 lakh COVID-19 cases recuperate and recover, pushing the national recovery rate to over 80%. A number the country's health officials claim is the highest globally.
It is right that the recovery rate in India has improved. Initially, it used to be about 65%, but now the recovery rate has crossed almost 80%, so which is a very good sign. It is a good silver lining around the cloud that we have now better recovery rate. And the second point is that we are discharging almost, according to Health Ministry, we are discharging almost 90,000 patients every day, which are being recovered and they are being discharged. But on the other side, it is also true that we are adding almost 95,000 to almost 1 lakh patients every day, and almost 1,100, 1,200 deaths are happening every day. So we need to be very careful.
The high recovery rate also ensured India's COVID-19 fatality rate remained low at 1.6%, but India continues to be the second worst hit nation with more than 55 lakh confirmed cases. And India's positivity rate continues to hover around 18%. WHO recommends countries try to control their positivity rate till a maximum of 5% to allow healthcare systems to care for the infected. Experts point out, India's focus now must remain on reducing the spread of infection and ensuring that widespread testing continues so that the positivity rate is pushed down. The question, however, is a consistent increase in recovery rate an indicator of the COVID-19 situation improving?
Dr. Thakkar, let's focus on recovery. We are seeing recovery rates now crossing 80%. Is that a positive sign? How long do you believe it takes for someone to recover from a bout of the virus? Is it again linked to the nature of the immunity systems of an individual?
So, if you have a normal human being with fairly good, adequate immunity, maybe 1 or 2 risk factors, by the time it is the 9th or the 10th day, he turns the corner, and by the 11th day, he's rearing to go. But I must admit, this recovery rate data that you have, I am seeing in the last 4 to 3 weeks that patients are turning around quicker and are having milder disease. And I'm seeing the pendulum at the other end also. Those that are afflicted with serious illness are really getting into trouble. But we are seeing more and more people recovering a couple of days earlier than they were recovering before. We used to have 11th day, 12th day. We are discharging patients on 7th day, 8th day. So there is the silver lining to this gray cloud. Now, whether it means herd immunity, whether it means mutation of the virus to lower virulence, or better treatment,
But
probably awareness brings patients earlier. Who knows? But there is definitely some method to this madness where we are seeing better recovery rates. And I pray for the community that this is true and will continue and march forward.
But even if I recover, whether it's in 8 days or 11 days, as you're saying, how long should I be, doctor, under some kind of observation over the next 6 months? Do I need to go back to my doctor? Do I need to go back and get tested every few weeks? Is that necessary at all?
We don't test anybody once they have an infection. We tell them that by 12th to 14th day, you will be negative. We keep them on blood thinners for 6 weeks to 3 months, maybe longer if they have comorbidities. We tell them to be careful and watch their saturations and look for odd symptoms. But I don't want to waste the money of the patients and the time of the doctors by calling them repeatedly to do tests. You come if you have a problem. You prophylactically take blood thinners, you take your vitamins, you look after your lifestyle, there shouldn't be a problem. COVID comes, COVID stays, COVID goes, and COVID recedes into the past. If you are careful, that doesn't mean if you've had COVID, you shun social distancing or you don't wear a mask, because you're as much responsible for the other people as you're responsible for yourself.
Dr. Chawla, what would you advise to patients who've recovered from COVID? What kind of advice do you give, Dr. Chawla, in terms of, let's say, the kind of meals they should have? Is there a particular health plan that you believe they should maintain?
I'll tell you, because I've been managing these patients for the last 8 months. And, there are different people who had a milder disease and who had a very minimal symptoms. They have no comorbidities. After 11th days, they are discharged if they had some symptoms which required admission. And then after 17 days, they are normal. And then they are asked if they have any trouble, then they come back. Then there are patients who are diabetic. What I'm finding, the diabetes is one of the major risk factor for getting them into hospital and getting them into the ICU. And patients who have comorbidities like diabetes, the chronic kidney disease, the blood pressure or a coronary artery disease, these are the patients or patients who had complications in the hospital or otherwise which were managed on the OPD basis. These patients require the regular follow-up. And people who had a lot of pneumonia and had requirement of oxygen, these patients also we call them because many of these patients will keep on complaining of breathlessness. And when you do their lung functions, they are pretty normal. So they have to be followed up. It is just 8 to 9 months of follow-up of these patients. So we'll know how these patients behave. But it will all depend on the comorbidities and how much the patient suffered. One of the other comment about the patients who are getting better, 80% have recovered. Of course, the absolute number appears very good. No, but let me tell you, the absolute number which are coming to the daily hospitals, the number of patients getting admitted to the ICUs has really increased in the last about 2 months, because as you know, the number of cases have also increased, number of patients requiring ICU have also increased. So maybe the percentage appears better, but the absolute number has increased in the last about.
That's an important note of caution you're sounding there, Doctor. I just want to understand, and this was a point just now that Dr. Chawla made, Dr. Thakkar. There's been a lot of talk in the medical community about the long-term impact of having fought off this virus, and this can lead to chronic fatigue, acute respiratory distress syndrome, even in some people post-traumatic stress disorder. Is that something you've been observing, or is that again linked to my level of immunity and the fact whether I have comorbidities or not?
Unfortunately, the people who have comorbidities develop a significant amount of lung reaction and lung pneumonia. So this, even when and if they heal, they gets compromised in the form of poor lung function. They are left behind with a pulmonary disability where they become breathless from the slightest of exertion if they have had significant pneumonia. I'm afraid 3 to 6 months later, we are going to have a large population of people who, if and when did recover because of probably delayed treatment, have a significant amount of impairment of lung function. So what we call as interstitial fibrosis, lung fibrosis. In America, I am given to understand there is a queue already of patients who are awaiting lung transplant because the COVID virus with its unique pneumonia has destroyed so much of the lung that you're okay sitting in one place and breathing on room air or a little oxygen, but your capabilities for movement gets compromised. You definitely can develop a mental syndrome because of what you went through. And clotting disorders, we are trying to curtail by giving anticoagulants and aspirin for long periods of time. With like my colleague said, the disease is 9 months old. We are learning, we are thinking on our feet, and we are trying to plug all the loopholes.
You know, I must ask you this. In a health ministry circular, Dr. Thakkar, on the 13th of September, the post-COVID management protocol, this is of the government, states that one should take herbs like ashwagandha and chawanprash. Is that what you recommend? Do these work? What do you recommend for people to ensure that the process of recovery is completely smooth?
Sir, unfortunately, I do not have too much knowledge about the good ideals of Chawanprakash and herbs that you mentioned. But I tell them to take their multivitamins, their calcium, their proteins, to live healthily, to keep yourself well ventilated, and to see to it that if you have comorbidities, your blood pressure should be well controlled, your blood thinners should be taken, your sugars should not go haywire, and you must be careful that you do not pick up any super added infection. The good points of other indigenous medication, the patients can decide depending on which specialty doctor wants to advise. I can say healthy eating, dry fruits, nuts, vitamins is what I can say, along with prescribed medication.
So you're saying in a way that along with prescribed medication, take, ensure that your vitamins are there, ensure zinc tablets. A number of people are recommending zinc tablets. Do you recommend that, doctor,
I want to exercise one caution here.
Yes.
I've written about it in the newspapers. We are seeing a spate of hypervitaminosis D, hypervitaminosis zinc. Everything in good portions is good. Don't overdo it. The disease has been there for 6 months. I've had people taking 6 months of zinc and C and D and having hypervitaminosis. So please balance it out. Be rational, take what you have to, but don't blindly follow into the alley because zinc in small proportions will help. Zinc is a metal. You don't want to go toxic.
Okay.
This is my word of caution.
Dr. Thakkar, as always, it's been a pleasure talking to you. It's very useful to get the news that you can use. I must now be very careful of the zinc tablets, certainly, that I take. Have them, as you say, in moderation. Thank you very much for joining us, Dr. Thakkar, Dr. Chawla. It is news you can use at a time when recovery rates are slowly climbing in the country. That's what we do on the News Unlocked. News without the noise. Thanks for watching. Bye for now.